Okay. Hello and welcome to our guest speaker for today during our Health Telesummit. I have with me today Dr. Carolyn Messere, and I'm going to let her tell you a little bit more about herself. But just to begin, she is a former colon and rectal surgeon who now practices functional medicine and more of a holistic approach to wellness. And she is here today to talk with us about emotions and how they can contribute to imbalances in the digestion system. I am super excited for today's topic. In the practice that I do of health coaching over the last 7 years, this is a trend that I am seeing more and more of, and I don't know if it's just my awareness or if it's, those are the clients that are coming to me, but I've really personally been transitioning into a huge space of emotional empowerment when it comes to our attachments with food and our lifestyle and how that all comes together. So I'm super excited for today's topic. Thank you so much for being with us here today, Carolyn. And I'm just going to invite you to tell us a little bit about your practice and how you got to where you are in the work that you do.
Thanks, Jen. I'm really excited to be here today. I've been really looking forward to this. So a little bit about me. I was a colorectal surgeon, and I did that for almost 10 years. And before that, of course, I was a resident. So I really was in like that whole conventional medicine paradigm for 20 years, between medical school, residency, and 10 years of practice. And what I started to see pretty early on, I think, was that people got well if they wanted to get well, if they set a commitment to themselves to get well, if they believed they could get well. And if they really truly had a negative feeling about things or they were worried about things, then they were slower to get well. Maybe they'd still get well, but it was more of an effort. It took more on my part. It took more on their part. And I spent a fair amount of time talking to people in my office while I was getting ready to talk to them about surgery, talking to them about what their life was like, what was going on with them, what they were nervous about, what was bothering them. Because very few people ended up in my office who had perfect lives or perfect emotions. In fact, there's probably nobody really like that anywhere. But for sure, what I saw was that it really seemed to make a difference for people if they had that, if they at least were willing to see who they really were and what was really bothering them. And I could tell you right off, if people were not willing to even look there, they left. They didn't work with me. I wasn't their kind of doctor. And the people who wanted that sort of stuff came to me in droves. And what I started to realize is maybe this is not what I was meant to do, cut things out of people. I was good at cutting things out of people, but I was much better at getting down to the really heart of what was going on with them. And I saw so many people who came to see me with irritable bowel syndrome, with chronic pelvic pain, with those sorts of things going on with them, that if you could help them resolve some of their emotional stuff, those pains got better. The irritable bowel got better. And I wasn't giving them any medication. I wasn't even barely talking to them about what they ate. Yes, I was talking to them about what they ate, but not that much. And the other thing that I've been seeing that really seems to make a difference is an understanding of what our relationship is with our microbiome, with that bacteria that occupies our body. And a lot of people talk about the GI tract, but you have it everywhere. It's on your scalp, your face, your skin, everywhere, in your vaginal tract, in your urinary tract, in your brain. You have bacteria everywhere, and they all have a balance, a certain way that they're supposed to work. And one of the things that I've really been seeing and studying is the fact that when that balance is off, it actually can cause your brain to be anxious. It actually feeds back to your brain, we should be worried here. And when you get that balanced, when you start to balance the microbiome, the bacteria, especially in the GI tract, when you start to get that balanced, then your brain feels better. You have a better outlook. Your lifestyle feels better. It's like a little bit of a double step. You fix your gut, your brain gets better. Your brain gets better, your gut gets better. We need that, right?
Yeah, that's so awesome. Thank you so much for sharing that. And I really acknowledge and admire your willingness to see the big picture and the practice that you were in, and to know that there was another way to address what was really happening. Maybe the way that wasn't always easier for everybody, but you knew that there was another way that could be better for the long-term health for the patients that you were working with. And just so grateful for doctors like you in your community, in our community, who are willing to step outside the box and think about all of the things that really do affect our health rather than just treating the symptoms. So such a great gift that you offer to the community, and just so grateful that you're here to share that with us. I would like to, before we start on the topic that we're covering today, I would like to invite you to share something just unique or personal about yourself, just so that we can connect with you as a person outside of the work that you do. So if there's anything you'd like to share, just for those of us that are on the video or listening, this is your time to shine and share.
Well, you can't really see as well as I'd like you to be able to see, but this is where I live, is in the middle of pretty much a tropical paradise. And that for me is so much, so important for being in touch with who I am. I love to go down to the beach. I love the water. I love, I'm not like you. I don't spend a lot of time doing like surfing and that sort of stuff, but I do really love to just get in the water. I really love living on the beach. I really love being, outdoors and being in touch with with nature around me. I think it's really important. I think one of the biggest things that's happened to us in our lives is we live these sterile lives where we're like in a carpeted, air-conditioned environment all day long. And they've done studies, and the inside air isn't as healthy for us as the outside air. So for me, I need to be outside in touch, breathing like the sea air. That just means everything to me.
Yeah, that's actually been a very common theme throughout the week. If you've listened to all the recordings, I think every single person, yep, every guest speaker has said the same thing, how much they love the outdoors. And I think it just goes to say something about just our awareness and like the whole body healing, and just knowing that our environment is also an important part of who we are and our health and well-being as well. So thank you for sharing. And I also know that you also enjoy sacred geometry, which was something that you shared with me before. It's kind of your creative, artistic side.
Yeah. It's funny because I always saw myself as a writer. I never saw myself as a speaker or an artist. But what I'm starting to see about myself is like, there's so many ways for me to express my art, and writing is just one of them. And I took this class just recently in sacred geometry, and it was every week we draw a slightly different geometric shape, but everybody did the same shapes. We all used our little compasses and drew our tree of life or circle of life or whatever we were drawing that week. But then every one of us would get out our pencils and our paints and our markers, and no two would look alike. Every one of them would be just a little bit different. And it really allowed us, within the frame of something that is rigid, to expand into creativity. And I loved that. That was an amazing thing for me. And I think that's, again, it's so important for us to have like this 360-degree whole life where we're expressing everything about ourselves.
Yes, absolutely. I totally agree with that. It's really important for us to express our creativity and to tap in with that, because that is part of our health and well-being as well. Mm-hmm. It's that whole second chakra actually is where we connect that up. So, well, thank you for sharing that. So I'd like to just open up the conversation about why we're here today. I'm really excited for you to talk about this topic. I think that, and I know that as a holistic health coach over the last 7 years, I had my own personal experience 3 years ago that showed me that when at the peak of eating clean, I was eating so healthy. I had overcome all the things I was dealing with. Yeah. And my business was doing really well. And I guess I was under some stress and wasn't really managing it. And I still had a health crisis. So that was a message for me. That's when I decided to, do some training in meditation and yoga. And so part of why I love having you here is because I know, because it's been part of my journey. And the method that I use with my clients now is that we get into emotional empowerment and attachments with food. We start talking about that because probably 80 to 90% of the time I'm working with, and I work with mostly women, it's not really about the food. Many of us know to eat healthy, and we can reduce inflammation, and we can feel really, really great. But the lives that we live now, there's a higher level of stress now with the constant cell phones and the social media and the constant stream of information that's coming to us, the amount of activities that our kids are doing, the level of work commitment that we've put ourselves in, especially as women. And I know that that is not healthy for our nervous system, for our gut, and that we can eat as healthy as we want, but if we are in a constant state of fight or flight, which a lot of people are, and a lot of women have adrenal fatigue, which throws off our hormonal balance, which I know that you have a little bit to say on that too, but that can show up in different ways as well with an imbalance in our digestive system. So I think this is going to be really, really great information for everybody to hear. And because I don't know that everybody is making that connection yet. You know, a lot of people can do the physical, the fitness and the working out, but the emotional thing that is not so tangible is a little bit harder for, I think, for us to realize. And so with that being said, I'd like to open it up for you to share more, maybe go a little bit deeper. You shared the why and how you got into this work, but what is your view, and what would you like to share today with how the emotional component of our digestive system and the parasympathetic system?
So I did a consult just the other day, and it was interesting because it was with a physician. So it was a little challenging for me. I was a little bit like, I hope he's going to be open to what I have to say. But I literally spent the first 45 minutes of our hour and a half call talking to him about what he does with work and family and all the stress things that he has going on with him and how he deals with them. And, one of the things we got down to was that he has to deal with rather difficult people at work. And we all do. Everyone has to deal with difficult people. Even sometimes my clients are difficult, just being able to kind of connect with them can be difficult. And so talking to him about ways that he can reframe those relationships, those conflicts, because we approach conflict with this like, oh God, I don't want to do that. We worry about it for 20 minutes, an hour, 2 days before we even get to it. We've already made it into that little molehill into a huge mountain. And instead of doing that, to do some positive reframing, to start out in the first place thinking to yourself, this is going to go great. It's going to make a big difference for both of us. This is going to shift what I have to say to this person is going to actually shift not just our relationship, but all the impact that we have again with other people. So starting from there, instead of starting from, oh my God, I don't even want to talk to this guy. It's just too much for me. And because of that, what happens with that is that instead of getting that, we talked a little bit about how the stress system works, but the big hormone that's involved in stress is cortisol. And I'm sure we've talked about that on other talks, and people are somewhat aware of what it is, but cortisol is adrenaline. It's what your adrenal glands produce, not for short-term stress. That's adrenaline, the actual adrenaline. But when you have long-term stress, then the adrenal glands start to produce something called cortisol, which is a longer acting stress hormone to maintain your system. But what it does is it keeps you constantly in your sympathetic nervous system. That's fight or flight. That's not rest and digest. That's not allowing you to be reproductively whole. It's going to keep you always on the edge, and your body's going to rush through digesting food, or it's going to stop completely. So you'll see people who are really stressed, they either have diarrhea all the time or they have constipation all the time. And it's because their system is going, well, digestion is not important right now. We got to be ready to run. We've got to be ready to to defend ourselves. And so when we're constantly in that high cortisol level, among other things, the blood sugar is always high. Your body produces a lot of estrogen because estrogen is needed to keep things on that higher level, that stressed out level. So you're producing a lot of estrogen, but you're not necessarily producing a lot of testosterone or progesterone, and you need those in order to feel good. Progesterone's like your feel good hormone. It's the one that like kind of, you'll notice that right before you're going to ovulate, a lot of times maybe you're a little bit moody, but you're also like happy. So if you get caught up in the sympathetic nervous system, none of that works correctly. Your GI tract doesn't work properly. The bacteria in your GI tract don't get fed properly. And then they're going to get off. And when the GI bacteria are off, your brain's going to be off. So anything that we can do to keep those cortisol levels down to a lower level is going to be really helpful. One of the things that I work with a lot on people is how to tone your parasympathetic system. So the parasympathetic, that's the opposite of the sympathetic system. That's where your body rests, digests, reproduces, relaxes, loves. That's like your rich human experience is all going to be in your parasympathetic. It's not that your sympathetic doesn't add to it, because we all like a little tension, a little drama, a little excitement, but we don't need it 24 hours a day. We need it an hour a day. And the rest of the time, we should be living in our parasympathetic system. We should be letting our vagal nerve kind of keep the tone on our body, keep our heart rate low, keep our blood pressure in a normal range, keep our cortisol levels down, allow us the time to digest our food, to enjoy our food. Because if you've ever noticed, when you're like, all that blood sugar is really high, food doesn't even taste that good. And yet you're craving it. And the hardest thing is with the cortisol being high, you crave sugar and salt. And it's really hard to get rid of that craving if you don't get that cortisol level calmed down. So one of the things you can do, you have this vagus nerve, and it runs all the way from your brain all throughout your entire system. It's technically, it's meant to be a cardiac and a GI nerve. But the truth is it impacts everything. And it's got little branches that go to the adrenal glands. It's got little branches that go to your reproductive system. It's got little branches that go to your liver. So it touches everything and it affects everything. And it gets out of whack. It's just like any other part of your body. If you're not using it, it gets out of tone. So some of the things that you can do to get your vagus nerve retoned. Meditation is awesome. Not everybody's going to be able to sit for 20 minutes every day. I think most of us find that to be challenging. And especially to sit, especially to do like that classic meditation, where you just sit and you clear your mind. Who's good at clearing their mind? You talk to Pema Chodron, this is a woman who's been teaching meditation for 40 years. You think she's good at clearing her mind? No. So please don't put that pressure on yourself. It is not necessary for you to sit every day for 20 minutes and clear your mind. Sorry. Much better to spend 5 minutes and visualize. You can listen to a guided meditation. I find I have a huge library of guided meditations, and I can find the perfect one to go to for whatever's going on with me that day. And, I love having someone else walk me through the little steps of breathing slower, breathing more focused, being more focused on the relaxed part of my body, being in touch with the relaxed part of my body. Because, when I was a surgeon, she didn't even exist. That was part of the problem. When I was a surgeon, I was so burned out because I was always in fight or flight. I was always supposed to be somewhere I wasn't. And that's honestly one of the reasons that I stopped doing it, was because even though I had a great life, I was making good money, I was helping people, I was doing some amazing work, but I wasn't happy. And I realized that it's important. Me being happy is just as important as my clients and my patients and the people that I was around being happy. So anyways, one of the things that you can do besides meditation, and I'm going to send you guys a guided meditation that's specifically for working on your health and shifting your DNA so that you're producing the more beneficial hormones in your body and just being more relaxed. Some other things that you can do: humming, singing, deep breathing. Those are all going to help that vagus nerve that runs right through here in your neck. So anything that you do with your voice, the vagus nerve is all involved and everything's going on in the larynx. And the truth is, if you think about it, when you're in fight or flight, you're either yelling really loudly or you're completely silent. So you're not using your voice. You know, you're using your voice in a way that's revving up your system. So even just doing what I'm doing right now is like speaking in a moderate tone, you know, telling your brain it's okay to be relaxed. You don't have to be too excited. You don't have to be too crazy. You can just be you. That's going to help tone that vagus nerve. It's going to help it to do its job. And what it's going to do is it's going to lower your heart rate. It's going to decrease your sweat output. It's going to calm your adrenals down. It's going to get your GI tract to do what it's supposed to do. The vagus nerve actually makes your GI tract move. Whereas if you're in fight or flight, your GI tract stops moving. It either just gets everything out as fast as it can, or it slows way down. So
can you talk a little bit more about that? You said if you're in fight or flight, that you just hit the nail on the head right there. The digestion actually changes. It either stops, because I see this in clients that I work with too.
Yeah.
I think it's really powerful coming from you, especially this is your area of specialty. You were a
Mm-hmm.
colorectal surgeon. So can you maybe explain in a way that we might be able to understand just how the communication is or stops working in that area?
Yeah. So the way that your GI tract works when it's digesting is there's these little pulses that move through the whole GI tract. They're called MMCs, or migrating motor complexes. That's the fancy word. But there's these little pulses that are supposed to move through your whole GI tract, and they move the food through. And that's like the normal way that your GI tract works. And it's like there's a pacemaker to the gut, just like there is to your heart. And the vagus nerve is the pacemaker for both of them. So what it's supposed to do when the vagus nerve is working is it's going to slow your heart down. It's going to make sure that your blood is mostly going to your GI tract, and it's going to get those little muscle complexes moving in a coordinated pattern so that your food moves through the whole GI tract, gets absorbed the way that it's supposed to. Water goes in, water goes out, nutrients get pulled out, waste gets put in, and it all goes through. And when your vagus nerve is well toned, when your vagus nerve is working properly, then that's just going to happen. You're going to sit down, and right before you start to eat, you're going to look at your food, you're going to smell your food, you're going to enjoy the concept that you're about to eat something really good. Even if it's, a cabbage smoothie, just, tell yourself, this is going to be so good for my body. Cabbage is so good. It's got all that sulfur in it. It's so relaxing to my GI tract. It's so good for my inflammation. You just tell yourself these things right before you eat. That immediately triggers that vagus nerve. It's called there's a name for it, but it's the pre-digestive phase.
Yeah, it actually starts producing, the smell of food actually starts producing digestive
Exactly. Yeah, exactly. You produce a little bit more acid, you produce more enzymes. Your pancreas starts to get geared up for that sugar load. So it gets ready to get all those carbohydrates in. Your liver starts to get ready to digest your fat. So the more you can do that little bit of just touch into your body, don't eat mindlessly. That's going to allow all that coordination to begin. All the enzymes are going to start to work. The acid's going to be where it's supposed to be. Those muscle coordinations are going to happen throughout your GI tract, and everything's going to move through in the amount of time that it's supposed to, and you're going to absorb as much as you can from it. And the other thing is that way of eating, your microbiome, your bacteria, they're responsive to your brain. So if you tell your microbiome everything's okay, then your microbiome grows the way that it's supposed to. And you start to settle out and have the beneficial bacteria and not so much of the bad bacteria. So a lot of people talk about, I take a probiotic, I'm fine. Probiotics not the thing. It's great. I know we're doing it with this cleanse. I know we're doing it every day. And I know there's been a lot of talk about it. And I love probiotics. But if you don't have a GI tract that's receptive to it, If your GI tract isn't ready for those bacteria, they're gonna go in, go out. You'll get some benefit. I'm not saying you won't, but it's not the benefit that you could get if you actually like get that vagus nerve toned, you actually get those digestive enzymes going, you break your food down, you chew. It's so important. Chewing is another thing that gets that vagus nerve ready to go, gets your digestion ready to go. And when we chew either really fast or we chew like 3 times and swallow, then our body's kind of like, you don't really want to eat. I can tell. You're thinking about something else.
Yeah, I love what you said about the probiotics, because it's never an easy question to answer. There's so much more that goes into, like you said, whether or not that probiotic actually sticks in your digestive tract or not, because many people assume that taking it is all they need to do. And I know from my own personal experience, that happened with my daughter, who lived in survival mode, fight or flight mode for many, many years when she was heavily prescribed on medication. And we would do stool testing and we would give her the probiotics, and she would have none in her system. So I know for a fact that that is true. And then we would begin other things, some inulin and reducing inflammation. And we had to get her gut in a place where she was even able to absorb the probiotic in the first place. Mm-hmm. And so what I want people to understand is that if you are a person who is making relatively healthy choices, and you feel that you know what foods work for you and which ones don't by now, but there's still a digestive imbalance, that this probably, for me and what I see, and I'm sure that you agree, that looking into what is the imbalance that's going on in the sympathetic system right now, that's really the next thing to possibly look at. I had a couple questions that came up as you were asking, if you don't mind me asking. You talked about the absorption of food. What about the absorption of water? Somebody who's chronically dehydrated, is that a factor also in somebody who's in a chronic state of stress?
Well, most of your water gets absorbed through your stomach. So for a lot of us, the truth is when we're stressed, people are going to find this completely counter to what they've been convinced of. When we're stressed, we actually don't produce enough stomach acid. When there's not enough stomach acid, then the cells in the stomach can't do their job. They don't work properly. They're designed to be in an acid environment. And so, among other things, they don't absorb water, they don't absorb food, the muscles in the stomach don't break your food down the way that it's supposed to. So your food doesn't get digested properly, and you're not really getting in enough water. The other thing is, if you don't drink enough water, your body needs a lot of water to make enough stool to keep everything moving through. That's really important to it. So even though, yes, it's absorbed there, it gets put back out into the GI tract at various points along the small intestine. That's a lot of the job of the small intestine, balancing water in and out to make sure that everything's moving in the right direction. And then when you get to the colon, it actually starts to take a lot of the water out so that it makes a more solid bowel movement. So if you're not getting enough water, then the digestive enzymes don't work. The pancreas doesn't do what it's supposed to do. Your adrenals get stressed out because much of their job, people think, oh, their only job is stress. There's another whole part of the adrenals that manages your salt balance in your body. And it's a big part of managing your salt balance in your body is making sure you're not dehydrated. So if your body starts to think it's dehydrated, then the adrenals are going to send out a hormone that's going to make you hold more onto the water that comes in. So then it's not going to go into the GI tract because your kidneys are using it, your heart is using it, your blood vessels are using it. So it's not in your GI tract doing what it's supposed to do, which is help you digest your food. Does that answer your question?
Yeah, absolutely. And I love that I know enough to understand and follow everything that you're talking about. It's just such great information that you're sharing. And I think it really means a lot to be able to hear it from somebody like you, like I said, who had the experience of doing the surgery in this area. I mean, you really are an expert from knowing what works and what doesn't work. And I just really honor your commitment to this practice. It's very progressive, and it's the way that I'm hoping and seeing that more people are moving and being proactive with their health rather than getting to, yes, Jane said she is awesome. So the question I want to ask, because I know we've got about 10 minutes left, what are some symptoms? Sometimes we just need to hear it. Some symptoms, and let's just be specific to women right now, that we would notice when we are out of balance. So when we are in that chronic fight or flight, what do those symptoms look like?
I think one of the first symptoms that you'll see in people is that they only are breathing out of the upper part of their chest. So they're talking or they're moving around or they're doing whatever they're doing and they're focused up in here and their diaphragm's not doing anything. So, and I didn't mention this earlier and I should have. One of the things that happens with us helping the GI tract to work properly is that the diaphragm moves up and down and that moves the lymph through the GI tract. So if your diaphragm's not moving up and down, if you're not breathing with your diaphragm, if all you're doing is breathing up in here, which tends to be what we do when we're in fight or flight, especially when we're preparing, not so much when we're actually running, of course, we're using our whole lungs, but when the problem we have with stress is that we're preparing all the time for this run, but we're not doing it. It's not happening, you know, so that's probably the first thing is that you'll notice that you're breathing and you're not moving your diaphragm at all. Another thing that you might notice is that your resting pulse when you wake up in the morning is high. For a lot of people, if you check your blood sugar, you'll find that your blood sugar is just slightly high in the morning when you wake up, or it's slightly high right after you eat a meal. That's another sign that things are out of balance, because what normally would happen if your pancreas was working exactly the way that it's supposed to and your body was in parasympathetic mode, is your body effortlessly manages your blood sugar in a very tight area, in a very tight balance. And people think, oh, it's okay that I ate a meal and then my blood sugar was 180. That's not okay. Your body's not meant to be that way. So I know not everybody checks their blood sugar. I do encourage people to at least think about it. It's so inexpensive to get a blood sugar monitor now. You can get one for $10 or $15 on Amazon. And if you buy the True set, which is what I usually use, I think it's True Result. They've changed their name a couple times. I think True Result, their strips are very inexpensive. So it's not like you're investing hundreds of dollars to kind of get a good sense of what your blood sugar is. And honestly, knowing what your blood sugar is going to give you a good idea of how stressed you are and how much cortisol you're processing in your body. So your temperature in the morning, actually, it's not going to be high. Everybody thinks it might be high. It's actually going to be low. Mm-hmm. And if you take your temperature every morning, same time, let it sit for a few minutes, don't just stick it under your tongue and read it. Those digital thermometers, they're not necessarily our friend. I really actually love the non-mercury but glass thermometers, because it really does give you a chance to get a sense of what's my temperature really. And so checking your temperature, if you start to notice your temperature is really low, your metabolism is off. Your metabolism is not running, and it's gotten to that point where it's exhausted itself. So those are some good signs. You notice also your skin. You might get a rash or eczema if you tend to be eczematous, or you might get those little bumps on the back of your arms. People talk about these all the time. So though I don't have any, actually, I finally healed myself of all that. I had KP, that's what it's called, keratosis pilaris. KP, I had KP for a million years and it just was normal for me. I'd get the brush out and I'd brush it, but it turned out it was just a microbiome imbalance and a stress thing. So it's one of the ways that I respond to stress is that I get those little bumps. So my skin is a very good barometer for me of how stressed out I am.
Yeah, that's what we talk about in our cleanse program too, is we all detox in different ways. So I think that the answer to that is that you're going to react in the way that your body is predisposed to act. Absolutely. In an easier way. So, and this is kind of a big question. We could probably talk about this one alone on a whole nother day, but yeah. What I see a lot is the endocrine imbalance and how that's showing up for so many women and their thyroid and with their hormone imbalances. And that also leads into what I know you're offering as part of this program. So I wanted to ask you a little bit about how that shows up in hormonal imbalances, because
Yeah.
hormones are a tricky thing anyways, right? I mean, they
Right.
seem to have a mind of their own. So it's hard for us to really believe
Yeah.
that, but the cortisol is another chemical that reacts to it. So can you talk a
Right.
little bit about how that shows up in the body, specifically to women?
Yeah. So one of the things that happens, especially when your GI bacteria are off balance, is that normally your liver is going to handle your estrogen. So it's going to break down the estrogen. It's going to make inactive estrogen. Sorry. It's going to make inactive estrogen, and then the estrogen is going to go out through the GI tract and out into the world, and you don't need it anymore. If you have an imbalance in the bacteria, especially if you're stressed and you're producing a lot of cortisol, you end up with this bacteria that will reactivate that estrogen in the GI tract and put it back into the system. So a lot of women who are stressed are what we call estrogen dominant. It's probably not the whole story, but it's a very, very common thing. And what you'll see with that is that your periods are a little bit long or heavy or clotty, clumpy. You're irritable. Your cycle ends up not being normal 28 to 31 days, which is what everybody else has. Especially what can happen is that your period starts later. You might get breast tenderness, you might get moodiness around your period. You might stop ovulating altogether, because if the estrogen is too high, then the body doesn't even think that it's going to get pregnant. That's how the pill works. When your estrogen level, it makes a high estrogen, and then your body says, oh, well, so we're not supposed to do all this stuff. We're not supposed to get pregnant. We're not supposed to ovulate. We're not supposed to do any of that stuff. So, so that's what ends up happening to people. And if you can balance out the stress and get the GI tract more balanced with the right bacteria, then you're not reactivating all that estrogen. You're not so estrogen dominant. And what's interesting is that even women who are postmenopausal can get estrogen dominant that way. They're not by lab numbers estrogen dominant, but they're estrogen dominant compared to what they're supposed to be, compared to what their progesterone and testosterone levels are. What you'll see is that estrogen level is still high. It might be low from the standpoint of like what it looks like when you're fertile, but it's still high for what your body needs. And that's going to still give you a lot of those menopausal symptoms. So for a lot of women, even if you're in the the perimenopausal, which starts for most women when they're in their late 30s, you start to have those changes in your hormones. You might not go through menopause until you're 50, 55. I didn't finish my menopause until last year, and I'm 54. But I started in my 30s. And so the more you can balance your thyroid, your estrogen out, the happier your body's going to be. And there's some great dietary things that you can do. One of the things that people talk about a lot, and I even saw it in some of your literature is that they think you shouldn't eat sulfur vegetables, the quote unquote goitrogens, because of your thyroid. But what we've really seen when we did the research on that is that those goitrogens don't affect your thyroid. It's a big misnomer. It's a big, to me, it's a big perpetration of bad science. So the truth is that even the only one that they found that actually really could be damaging to the thyroid, and it's only minimally so, is Brussels sprouts. There's some chemicals specifically in Brussels sprouts that your thyroid doesn't necessarily like. But the rest of them, you need those sulfur vegetables. You need that cabbage, that broccoli, that kale. The kale, you want to either juice it or massage it or do something with it. That's not because it's a goitrogen. That's because everything's captured in this very dense fiber in the kale, and you're not going to get the vitamins out of it. Plants were designed for us not to be able to digest them well. So we have to do some things to them to make them more digestible. The other big fallacy is cooking your goitrogens does not make them less goitrogenic. They aren't goitrogenic to begin with anyways, but even Brussels sprouts, if you cook them, it doesn't change anything. So that doesn't matter. You can cook them or not cook them. Raw is okay, but like I said, you got to figure out a way to digest. So you need enough digestive enzyme. You probably, especially with kale and some of the other like coarser, thicker, more fibrous vegetables, you want to break them down or massage them or chop them up or make kale chips, because that's going to both cut them up and roast them. So, but there's nothing wrong with eating those sulfur vegetables. You need them. They help prevent cancer, and they're great for helping you keep your hormones balanced.
Yeah, thank you so much for that clarity. That's really helpful. I know that that's been a controversial topic in the
Mhm.
world of nutrition and the endocrine system. And I actually just had um, a client yesterday reach out to me um, who's not used to eating kale and was experiencing a lot of bloat because
Mhm.
raw kale can be very, very difficult to digest if you're not used to
Yep.
it. Putting it in smoothies, I tell people use the spinach instead of the kale if you're not used to it, because it can be very hard to
Yeah.
digest, which makes it so easy to grow here in Florida, is because
Right.
nothing can, even the squirrels won't eat it here.
Right.
It's too hard
Yeah.
to digest.
Right.
So I think we're coming to the end of our time. This has been so wonderful and so helpful. I feel like I could talk about this for 2 more hours,
Mhm.
specifically as it's related to women's health and hormonal imbalance, because that is what I feel like I see all the time.
Mhm.
And I know that you said you were going to share that meditation, which I think would be wonderful. It's just, a way to know that we can get ourselves in more of that rest and digest state
Yeah.
before a big meal, or I'm thinking specifically like a business meeting with a meal, something like that. If you work
Yeah.
corporate, you gave us some really wonderful tools and some great insight. Just a simple hum, I think of as the
Mhm.
yoga teacher, the om, like
Exactly.
that is so, it's like the vibration of that is so calming and so wonderful that
Mhm.
I'm thinking that I might just have my kids start doing that before they eat.
Yeah.
It's such a great, you've shared so many good things with us. I'm so grateful. um, and does anybody, I see a question here. This is from Jane. So I think Jane doesn't want to give up coffee. She says, can anyone ever make peace with coffee? In other words, have it daily without super stressing the body? Absolutely. I think maybe I've made a couple comments about coffee can stress the adrenals. It's also very acidic, but you can put pH drops in it, make it non-acidic. What is your, I guess just to answer her question, what is your take on how to drink coffee properly without stressing the adrenals or upsetting the hormonal balance too much?
So I'm actually a big fan of what they call, bulletproof coffee or butter coffee or
Yes.
whatever that, you can call it whatever you want. And I drink coffee every day. I gave it up for a while, because I was super stressed, and I was in Peru for 2 months working with the shaman, and we weren't allowed to drink any coffee while we were there. And I just kind of gave it up. And then one of my friends started talking to me about the bulletproof, and I realized, I want to give that a try. I want to see how that goes. And what I've been finding is that it's, I do 1 shot of coffee. It's only, I use the AeroPress, and I use dark coffee because I love the taste of my coffee. But the truth is dark coffee has less caffeine in it so the more you roast coffee, the less caffeine there is in it.
Mm.
People don't always realize that. They think that that espresso's got a lot of caffeine in it. It's just because it's concentrated. It's the way you drink it. But so
Right.
I drink basically what's somewhat along the lines of an espresso pretty much every day. And I mix it in the blender with a tablespoon of grass-fed butter. And I really do try to make sure that it's, truly prairie raised butter if I can. I don't want my butter to have been fed any grain. The beneficial fats that you get from grass feeding are so amazing for your skin, for your GI tract, for your hormones. They love it. And then I use the MCT oil, and I add a little bit of cacao and a little bit of maca. So maca is a great herbal adaptogen. It really helps to rejuvenate your female, I don't know what the word, it's not just like it balances your female hormones, but it does everything. It makes you more loving. It makes you feel more kind to yourself.
It's that all those feminine
It just makes
properties.
you more female. And it's funny because when men take it, it makes them more male. So it's because it's an adaptogen, right? It does what it's supposed to do. So I do my little bit of maca every day, and it gives you some energy too. So that little bit of, so what that does is I get my coffee, but I get all these other things that feed my body: the MCT oil, the grass-fed butter, the cacao, the maca. I get all of that. And then I also add collagen to mine. So I put 2 scoops of collagen in it, which is great for your GI tract. So your GI tract loves collagen. It really helps to close those little gap junctions so that your leaky gut gets healed. So I try to make it into like, rather than just like, had a cup of coffee, I did something amazing for my body and it tasted like coffee.
Thank you so much for sharing that. I'm not a coffee drinker. I drink Dandy Blend, but I do the same thing. I added my medicinal mushrooms and my beef collagen. I love. So yeah, Jane, I hope, where does one buy collagen? I don't know if I prefer what is it called? Vital
proteins. Yeah, they're expensive.
Yeah, and I actually get it on Amazon.
Yeah. So I have 2 brands that I really love. One of them is Wild Foods, which is a little gem that I found on Amazon. They almost exclusively sell on Amazon, and they have fabulous collagen, and you can buy a pound for about $23, which is about a third less than what you pay for the Vital Proteins. And it's the same. It's raised in Brazil, all grass-fed, grass-finished, hydrolyzed. It's all the check marks for good collagen. Right. And that's where I get my cacao maca blend. And the cacao maca blend also has a little bit of turmeric and a little bit of reishi mushroom. So
awesome.
It's great. It's called Cocoa Tropic. I love it. It's the best.
I'm going to be looking this up. Cocoa Tropic and Wild Foods, you said?
Yep. Wild Foods is the company. It's a company in Austin. And their coffee, by the way, is all organic, fresh roasted. So when you order your coffee, they roast it on Monday and you get it 2 days later. So
well, there you go, Jane. I think you got she's excited. She's got something new to try. She can feel really good about. Well, Carolyn, thank you so much for your time. I know that, can you please just share with us how you work with people, how they can find you, your website, and any special offer that you have for anybody who's listening today?
So my website's www.drmessere, so drmessere.com. It's still a little bit in transition, but everything's coming together. I don't really have a sorry. I don't really have a blog going yet, but I'm working on it. I do consults with people. I also do some energy work with people. So I do energy healing, and I do that either over the phone or in person. Unfortunately, I'm way down here in South Florida, and a lot of you guys are up in Jacksonville. I used to live in Jacksonville, but I'm not there anymore.
Well, Bernita's actually lives in Canada.
Ah, okay. So I do some energy healing, which I think really helps to balance your mind and your spirit, because, we said this earlier, you just can't really heal your body if you don't heal your spirit. What else do I do? That's mostly what I do. So I do functional medicine consults with people, and we do, it's like a 360 degree. We look at everything. We look at your physical, your mental, your emotional, everything. And then we come up with a plan for all the ways that you can adjust all of those things for you. And I do both short term, like you can do just one appointment with me, or I have a membership program and you can sign up and work with me every month.
So you do work with people who are not local?
Absolutely. Yeah. We do this. We do Zoom.
Yeah.
Yeah. Mm-hmm.
And then did you have like a hormone evaluation or? Yeah.
So for the people who are on the summit, I'd love to just, set up a 30-minute phone call with you. It's, it's included in the summit. And what we'll do is it's going to be a little bit more focused than one of my regular appointments. We're going to mostly focus on just like your hormones, your stress levels, and how we can sort of balance those things out together. And if they want to do that, they can. Yeah, so they can either get in touch with you and you can get in touch with me, or they can find me on my website. There's a little info box, send me information. Or you can email me. So my email is cmessere@drmessere.com. And you can just email me directly.
When does that offer expire?
I'm going to leave it open until July 1st. So you've got time to finish up your cleanse and figure out everything you're doing. And, as long as you're in touch with me before July 1st, then we'll get you in.
That sounds wonderful, Dr. Carolyn. I am so grateful for this conversation today. I know I've learned a lot. I'm sure the ladies on here have, and all those that will be able to listen to the recording. This is very enlightening, very helpful. It's such a breath of fresh air to really know that there are doctors like you out there that see the whole picture, that honor the mind, body, spirit, like just the whole big picture. I'm really grateful for all the work that you do. Thank you so much for joining us today.
Thanks. It was great.
And thank you to all those on the call. If you have any more questions, you can tag me or her today in the Facebook page in our group. Today's kind of her day. We'll make sure that I'll get you in touch with her if you're looking for that hormone evaluation. And then once we find the link to that meditation, we can share that in the Facebook group as well.
Yep.
So thank you so much. Have a wonderful day.
Thanks.
Bye.